Hi, good afternoon. I'm Dr. Randy Rudderman. Thanks for attending our first real virtual event. We really strive to provide you with the best patient care and education. So give us your feedback after this event today so we can continue to improve. Now I'd like to introduce Jenn Cobbs. Jenn is a certified PA. She's an advanced injector. She's a national trainer for Allergan, the makers of Botox and Juvederm. And Allegan picks only the best from around the country to teach new injectors the skills and new education for new techniques. So when you schedule with Jenn and our practice, you're actually dealing with some of the best injectors in the country. So here's Jenn Cobbs. Thank you very much.
Hello, everyone. Thank you so much, Dr. Rudderman, for that wonderful introduction. I am super excited to work with you guys today, and we are going to go over a presentation here to discuss the Juvederm family of fillers. And so we're just going to go ahead and get started here. If we can pull up our slides. Fantastic. Please let us know if you have any questions or trouble visualizing the screen, okay? So first, we're going to just talk about the brief overview of the product line. So Juvederm brand of fillers is a completely full portfolio of products to provide you with contour and lift and correction of lines and plumping of the lips. We're going to go to the next slide and start talking about what makes Juvederm so special. Okay, so Juvederm, again, is a collection of fillers, and what it is it's basically a combination of complex sugars of hyaluronic acid proteins, and these particles are then stimulated to make it into a nice form gel that can be injected into the body. Juvederm is a product line that includes the cheek volumization, the lips, the lines above the lips, and all of the lines around the mouth area. So what we're going to do is now break down each of those areas and which type of the Juvederm product will fit into those areas. So we'll go to the next slide. Perfect. So the benefits, why Juvederm? One, it's an amazing product line, and it is, as you can see, named the top injectable filler by Bazaar Magazine. So that kind of speaks volumes to the product line itself. This is a product line that is great for people that really want a non-surgical option for fillers, that want that instant gratification of seeing those results right away, something that is very long lasting. And I think most importantly for my patient population and most people around, you know, we want something that looks natural and kind of just is you, but better. So this product line gives you all of those things in one. Okay, next slide, please. Good. So let's start from the top, which is where it all begins. When we talk about aging, we want to know what products are going to give us that lift, that contour, restore that youthfulness to the skin. And that's where Juvederm Voluma comes in, and it reigns true. It's something that many patients say to me is, you know, I'm just noticing this flattening of the cheeks. I'm just noticing this new sagging. And as we age, we are losing those fat pads and we are starting to notice that descent. So Juvederm Voluma gives you that lift, gives you that structure to give you back that youthfulness. And what we love about this product line is the duration. It has a clinical indication to last up to 2 years. So it's a wonderful product that stays natural, but lasts a really long time. So we really love this product line here. We'll do the next slide. Thank you. So this kind of shows you that contour. So if you look at the first picture on that model, do you see that side angle where she's losing that flattening? We call that the OG curve. And if you look at 1 month after treatment, she's restored that youthfulness, the brightness in her eyes, the softening of that contour, the light reflection off of that cheek. It all brings and restores that youthfulness up and that contour back. And most importantly, if you look at the third photo, we see the aging. 2 years later, look at how she still maintains that natural look. That's what makes Voluma so wonderful. Next product line. Okay, so this product, I love to show you this straight on angle. If you take a look at this patient, one of the things that many patients will say to me is, I just look tired. What can I do to give me that brightness back? If we look at this model, we can look and see how the light reflection off of her cheek has changed in her after photo. We see not only the benefits of her eyes looking more rested and bright, but also if you notice, look at those smile lines, look at the softening that's occurred even below. So what we notice is that as we lift and contour those cheeks, we start to see the improvements to all the areas below in the lower face as well. And so this kind of leads us to look at the filler as one, lifting and contouring, but also addressing those other issues. And one of the things that I love to see is that we can kind of combine this treatment with the next treatment that we're going to talk about to smooth out some of those lines of the lower face. So if we go to the next slide, let's talk about our other options. So now we've lifted, we're talking about smoothing. So smoothing and giving you that subtle, soft smoothness to the lower face. Because we notice that as we age, we are going to obviously have to combat our genetic factors. We're combating our environmental structures. Those lines and wrinkles do begin to form in the smile lines and the lower lines around the mouth. So we have 3 products that we can use in this particular area to provide that rejuvenation. We have Juvederm Velour, we have Juvederm Ultra, and we have Juvederm Ultra Plus. And these products combined can provide a variety of options to treat you for those areas. So we are smoothing out those lines with something a little bit more subtle for those that need a little subtle plumpness and softness. And then we have a more robust product line to give you that lift and structure, depending on where you fall with those environmental factors and those genetic factors. And of course, those products can last up to 18 months for duration. So for those that are joining us here, we're just looking at some before and afters to show you what that subtle smoothness looks like. And so the first one up is Juvederm Velour. Everyone who knows me knows how much I love this product. It's such a wonderful, versatile product because it can provide that softness and that smooth subtleness. And if you look at her smile lines, and that's before picture to your left, you'll see those deep pockets that she's experiencing there in the smile lines. And then this is immediately after with that Juvederm Velour injected into that area. And we're seeing that correction, which is, again, like I said, instant gratification. And we all really love that. And so when I speak about that versatility, if we look at the second model to the right, we can see that her lines are not quite as defined as the previous model, but we still can correct those with that same product. So it's extremely versatile with the volume and the amount that you can use to achieve some really natural, beautiful results. As you can see from New Beauty Magazine, obviously a big popular product. Again, it was the breakthrough product of 2018. And I really feel like it was a true breakthrough because it just allowed that extra portfolio piece to fill in that need. And we just love this product line. So if we go to the next slide, we're going to talk about Juvederm Ultra and Juvederm Ultra Plus. So as I mentioned, we have a few products that can treat these same areas. And so this product is more of a fill product. So when you have those deeper pockets in the smile lines and the lines around her mouth, you can see the marionette area as well. We might want a product that's a little bit more robust, something that's going to get in there and fill that area, but keep it really natural. And that's where Ultra and Ultra Plus really fit the mold. These are our classic Juvederm products, and we love how instant these products feel, but how smooth the product still looks in the skin. It's still a very natural looking product. We are showing before and afters at 2 weeks for this, so you can really see that final result in the patient once everything is settled in. So we really love showing you that example as well. If we can go to the next slide, I want to show you another one. And again, as I mentioned, we are all varied. We all have different degrees based on our genetic and environmental factors. So deeper lines, more superficial lines, but we have something for all of them. And this is just showing you Juvederm Ultra in that same area for these more subtle, finer lines to the area, but we're still filling those to correction. And what I love about showing you this one is look at the last photo to your right. We can see that 1 year, look how much correction she still has. Excellent. So we're just adding a few more in, and we're now going to talk about the next area. So we've talked about lifting, we've talked about smoothing, and now we're going on to plumping. So the lips, again, an extremely popular area that we are now treating, but we have 2 options for our patients. We have Juvederm Volbella and we have Juvederm Ultra. Juvederm Volbella is going to give that subtle change in hydration to the lips, and we have Juvederm Ultra, which is going to provide that plumping. You know, we always like to say we are born with certain lips, so we can always make adjustments. Some are just genetically predisposed to very thin lips, but we have options for you that can still keep you natural and, again, make you you, but just a better version of that. And so these 2 product lines gives us that opportunity to do both. Let's see, we have the plumping effect, and like I said, that subtle volume. And as we talk about the duration, if we look at the clinical studies, again, we're lasting up to a year. So we really want to make sure that you get products that give you that long-lasting, wonderful result. Let's see here. We'll get to the next slide here. I think we have a few more. There we go. Okay, perfect. We'll get to those in a second. So we're going to get to those questions here at the very end, okay, you guys, for those that are sending them in, but keep them coming. We love to answer your questions. So the first product we're looking at here is the Juvederm Volbella. So I'm showing you that subtle volume that we were mentioning that can last up to a year. This product, if we notice in the before picture, we can see those lines in the lip body itself. And so we want to provide that hydration. And so this product injected into the area at the middle photo, you'll see those lines smoothing out, that contour being built around the body of the lip. And then most importantly, as I mentioned, the duration. Look at 1 year later, she still has a lovely hydration and fullness to her lips, but it still looks very, very natural. And that's why this product is that new beauty of 2019, because people love to look natural. I want my patients to always look natural. And I think this product is a great option for those that want to have that subtle volume hydration. And this product also has another indication. If we go to the next slide. And we're talking about the lip lines. How many of you have had that discussion or a discussion with your friends about those lines around the mouth, those little small fine lines, sometimes known as smoker's lines or barcode lines, but I just like to call them those fine lines or an opportunity that we can correct. So with this particular photo, you can see from the side profile where she has those lines and she's really lost that edge of that vermilion border, which is just like the lining of the lip. And so this product being so fine and so hydrating, we can go in and smooth that line out and really smoothen the lines above and below the lip. We've created a new plump hydration to the lips, but also some shape and definition for this patient. And I think that that kind of shows you that versatility of that product line. And this is why Volbella is extremely popular for our patients. And if we get to the next one, and I think I have another one here. I'm just going to add another. Just keep them coming. We're doing great, you guys. I'm just adding a few more in, okay? There we go. So moving on to lips that want to have a little bit more plumping nature or a little bit more fullness to the lips. And so these are for patients that are looking for that extra thing that as we age, we do just start to notice, I may have had full lips, but they're just starting to shrink in and I'm losing that volume. What can I do? And that's where Juvederm Ultra really comes and it shines beautifully in the lip. If we look at the first model, again, we talked about that hydration and filling in for those areas. And now we're getting that shape and that border back. And then, I'm sorry, I think we just had one more add-on. So I'm just gonna go over this one more time really quickly for those that have come in. Again, my name is Jenn Cobbs and I'm a physician assistant with plastic surgery with Dr. Randy Rudderman here in Midtown. And we are talking about the Juvederm collection of fillers for all of you guys listening. And we are now talking about correction to the lips. And so
that's just the chat.
The chat, okay. So we are just filling in here for the lips. And if we look at the model to the right, look at how hydrated and volumized those lips are. It is just a beautiful post result for that person that really wants that plumping nature. So this product, again, super versatile, but always very natural. And that's what we're looking for when we're injecting and giving you those product options that we have. And this kind of goes through that portfolio. I'm going to hit to the next slide, please, to just reintroduce. This is why, if you've just walking through this slide, we've talked about lifting, we've talked about smoothing, and we've talked about plumping. And with this versatility profile of the Juvederm family of products, we are kind of able to give you that instant gratification with a natural look and, of course, a long-lasting result. And so I think I do have a few questions that I saw coming in. So we have a few safety information data that's just going to read through there, and I want to get to a few questions. But also we are going to do a quick consultation so I can show you all what the consultation process would look like if you were to come into the office to see me. Okay. So really quickly before we go into this, because I know we're going to talk a little bit about Botox Cosmetics as well. So Botox Cosmetics is an injectable product that is used for dynamic expressions of the face. So this product is going to be used to correct those dynamic frowns, forehead lines, and lines around the eyes or the crow's feet. So we're going to be talking about these in combination today for this particular model. And so we've talked briefly beforehand, so we can talk out loud about her opportunities, but some of the things that we discussed were the concerns with the frown. I'm just going to slide or bang over a little bit. The frown or the furrow lines here in the forehead. So when we frown and furrow, we start to create those lines, and then with repetitive movement, they start to stick around and they become what we call a static line. So by treating with Botox Cosmetic, not only are we decreasing the furrow or the dynamic muscle movement, but now we're also softening and correcting those lines over time. So for this particular client, I would always start my consultation with a mirror, and I would have her express to me those concerns and what bothers her, and then we will walk through a full facial evaluation and determine the options for treatment for her. And so I know we talked about a few things here, and some of what I'm going to talk about is a little bit more catered to her and things that I would offer as an advanced injector here in the office. So I'm going to have you frown for me and furrow, and then lift up surprise for me. So those forehead lines and those frown lines we would address with Botox Cosmetics, and then the lines around her eyes when she smiles. Good. And then we talked about an opportunity to give her a little lift and to that brow line. So I would offer her a brow lift as well to give her that softness and lift and just kind of soften the smile. She has some beautiful structures here. I'm just going to use a little Q-tip to show you. I would always talk about the opportunities that I see in the mid-face, and that's where that Juvederm Voluma would go to give her that lift and provide that contour to the cheek to make that light shine beautifully here. We would talk about the smile lines here in this area and the marionette, softening these areas with some either Juvederm Velour or Juvederm Ultra. Typically with my patients, I'm a big pincher, so I like to pinch and assess the area. Her lines here are considered mild to moderate, so in this case, I would probably start with something like Juvederm Velour to give her that softness in this area, but these lines here have a little bit deeper pocket, so in those opportunities, I want to use that product we talked about for plumping and giving that support. So I would use something like Juvederm Ultra in this particular area to soften her. One of the questions that I did have already I wanted to bring up was a discussion about jowls and what happens and what can we do to correct jowls. And so jowls are basically where those facial fat pads start to descend, and we have our mandibular ligament that sits and attaches here on our face deep into the bony area. And so the fat pads, as they descend, they just kind of lay over that. So there's some things we can do to fill this particular area and restore some of that with a filler. And then I do some things a little bit more off-label to give her some lift and support. So there are some fillers that I can place in other areas to provide some support to her and give her a little bit more of a natural contour there as well, and as well as here, which is on-label, to the chin with Juvederm Voluma. In the body of the lip, she has a beautiful shaped lip, but what we can do is just add her that hydration and that subtleness here. So something like that Volbella that we were mentioning would be a great product to give her that subtle plump and hydration to the lips and just etch out that shaping a little bit more, especially on the lower lip area. And then as we talk about, there's a lot of family of fillers and other product lines. We could talk about some other areas of opportunity as well for the future. But this is just kind of a nice overview. If we look at that OG curve, we can see that she's kind of flattening out in this particular area. So using my filler strategically to lift her and contour this area, we can basically round back out that OG curve to that area there. And then, as I said, because we're lifting here, we're going to see some changes to this area as well as this area because those fat pads descend. So we're just restoring that lift and support there. Okay. Thank you, Miss Jennifer.
What about my temples?
Yes. So she asked a question. She said, what about my temples? So again, as I mentioned, as an advanced injector, I have training to perform some other additional treatments. And so one of the things that we do notice as we age, and honestly, it's one of the first things that a lot of patients will notice, is that this begins to, you lose volume in this area and we start to lose that shape. You can see the slight gapping there. So we can use things like fillers to fill in that area and provide her that restoration that she needs and soften that out so that it doesn't etch all the way in or there's not that convexity there. We can smooth that out there as well. Yes.
Okay.
Yeah. She's like, take care of that. Awesome.
You.
Thank you so much, Jennifer. And I do have a few more questions I want to answer, and then we're going to open up the floor here. So one of the questions that we had, which I thought was a really great question, was what's the best type of filler to get rid of, I'm gonna take this back off. What's the best type of filler to get rid of wrinkles but maintain a natural look? And I would say all of the above. Everything we've talked about today are products that will maintain a natural look. I think this is a combination of choosing the correct product, having the most experienced injectors take care of you, and we can provide that natural result. And so I think that all comes down to selection of product in your injector and making sure that that's the philosophy that they have is my goal is to give you natural results every time. You should always look like you. That's what I tell every patient. And we can develop a plan for you specifically. And then another question that we had related to Botox, they said, are fillers or Botox better for dealing with wrinkles? And so for this question, again, to the point of depending on where those wrinkles are, we would choose those products, and a combination of those products are probably necessary. So again, Botox is a neuromodulator. Its job is to relax the wrinkles from dynamic expression. So if you're having lines and furrows in the upper face, that's where Botox would come in. If I'm treating lines that have happened because of age and volume loss, that's where the fillers would come in. So depending on the area, I would assess you to determine which product would be best for you. And we probably would be a combination because we would probably have lines in both that we want to address. And then I did have, how long do any of these products last? Which is a great question. I think we briefly talked about this throughout the presentation. Again, all of the products here are clinically indicated to last certain durations with optimal correction. So Voluma has an indication for up to 2 years, the Juvederm Velour up to 18 months, and then Ultra is up to 1 year, and Volbella is up to 1 year as well. Botox treatments are typically done every 3 months. So our clients will come in repetitively for those treatments. I did have another set of questions. Someone did mention fillers to the temple, which we just addressed with Jennifer. So again, I can address those in office to give you a full consultation. It is really going to vary depending on where that volume loss is located. Again, sometimes it is a combination because we do age differently. So it may be a combination of some cheek filler and temple filler to give that lift and contour to the area and to the patient. And then someone else asked about their upper lip. With age, my upper lip is below my teeth, and what can I do about thinning of my lips? Great question, and I think we kind of mentioned this before, but we have 2 products that can help with the thinning of the lips, and with the full consultation, we could assess which product will be perfect for you, depending on your goals and how much plumping and or hydration you're looking for. So the Juvederm Volbella and Juvederm Ultra would be great products for either, for your lips, depending on what your goals are and how we can accomplish that. So that is more of an in-person assessment to make that determination for sure. Okay. And I think I do have a few more questions in the chat. So let me see.
I have a couple questions, but I should probably let the participants know. I work for Allergan, so some of these questions I'm going to ask because I know that they're questions that we get a lot as reps. So thank you guys for joining today. And Jen, you did a fantastic job. It was so great to watch you present for us. My question would be for somebody that's new to seeing you, maybe you could walk them a little bit through, you know, how you're seeing new patients nowadays with obviously some of the precautions you guys have in place.
Yes.
I'd also love to hear your approach to, you know, a new patient, what that would look like when they come in to see you, who they might see first, all of those things. Maybe talk a little bit about what the steps look like in your practice.
Oh, absolutely. And we do have a lot of new steps, so it is important to make sure that you guys feel safe. So the first thing that we do is we do have an electronic database so that when you schedule an appointment or consultation, you're going to be screened on the phone, of course, for questions regarding COVID and safety. We do have an EMR system that allows you to log in so that once you arrive to your appointment, you would let us know through the app on your phone, and that would we would let you know when the proper time is to come into the office. We want to eliminate traffic within the hallways or the waiting room. We have no waiting room traffic. We're keeping everything very safe. All of our patients are being checked with temperature and asked those additional COVID questions at the visit, as well as consents for COVID. We always review everything with you in detail. Hands are sanitized, masks are provided, and then we would take you directly back into the treatment room. So there's no, again, interaction within those hallways. And once we're in the consultation room, I would go over all of your medical history, which which would have been completed online through the portal system prior. And so we would check everything medically, make sure that everything is safe, and then we would really just get into the discussion of what your goals are as your treatment. So what your concerns are, we would go through all the details, talk about contraindications, options, and I'm a full service. I really like to just make sure I answer all of your questions. So if there's anything related, like I said, to skincare or your aesthetic goals, we're going to talk about those, and most importantly, kind of map out a plan. So we I like to say we age, over time. So it is a marathon. It's not a sprint. So let's talk about everything, every opportunity that we have, and let's prioritize those things that are most important to you. And we would start with like your Botox and filler and just kind of map it out. Like maybe we'll start with this area and then we'll move on to this next area over time. So most of my patients, I always recommend, like I said, Botox would be every 3 months for the treatment. So if at that point we wanted to discuss filler, we could do it at that visit if we didn't do it the first time, or just add on to a new area. So we just make those scheduled appointments throughout the year, and thus forth. And then of course, we always talk about maintenance. It is important that once we have that new look, we want to maintain it. So I like to see the, clients back again for touch-ups to make sure we're maintaining everything and volumize exactly how you want it. So that's kind of my approach. And then our checkout process is again very seamless. We have everything, protected and plexiglass so that we can check out seamlessly. And then we have a separate exit door so that we kind of keep the traffic flowing in a nice, smooth, safe way.
Great, thank you. What does pre-care and post-care look like? Like how long would a patient have downtime from some of these procedures perhaps?
Great question. So for the Botox treatments, we're going to have very minimal downtime. I'd say typically about 15 minutes, a little bit of some redness to the site. But with the fillers, I always say kind of anticipate anywhere between, 24 to 72 hours of a little bit of swelling could be expected in some areas more than others. So depending on the area, and that will be discussed so we could prepare for it. Typically the initial consultation is a 30-minute consultation where we kind of walk through all the preparation. There are going to be some patients where I'm going to medically recommend some treatment options or some things, medications that we're going to have to discuss to reduce bruising and things like that. So we would just walk through those plans and make a strategy for the best outcome. Some patients, it might be the same day. Right now we're wearing masks. So if you have a little bit of swelling, no one really worries. We just go about our day to make sure that, you feel comfortable with those options. So that was typically what I do. That's a great question though. And then again, we can start to appreciate those results immediately with filler. With Botox, we're going to be anywhere between about a week or so before you can appreciate the full effect of those results. And then I always do the follow-ups, like typically for Botox at 2 weeks or at 1 month for the fillers to make sure everything is settled in. And because of everything happening now, we do offer virtual follow-ups as well, if that's easier for the patient. So we try to make it extremely convenient. I think we have some other questions here. I think I have, how long after, okay, can you get your lips? So you can get your lips injected typically. Again, I would always defer to, your individual case. So again, there may be some swelling and bruising that we want to avoid after surgical procedures. So typically speaking, I'm going to say anywhere between a month after the procedure, I would be open to doing the lip injections, but that's going to vary from person to person in combination with that, just kind of depending. I think I have another question about furrow lines, so frown lines that are very deep. Okay, so this is a great question. So I think earlier we talked about that dynamic expression, and over time we start to have that breakdown in those furrows, and those lines start to kind of become more static. So what was dynamic is now static. So the way we want to address those are they're going to be a multi-step approach. The first thing we're going to do is make sure that you still have that activity of the muscle with Botox. And so I recommend when I see deep furrows, we are going to tier step that treatment. So the first treatment, we will perform a full correction of the Botox to that area for the furrow lines, and then a follow-up appointment at 2 weeks to see where everything settles. We may have to tweak it a little bit. And then every 3 months, like clockwork, we're going to address that with Botox. The way I like to think of it, and the analogy I use is if I folded a sheet of paper and we have this deep crease, the more I keep that muscle relaxed over time, that is going to straighten out and smooth out. But it is a commitment, because once that line is static, we are working in the reverse. So in combination, we want to make sure that we are hitting those with that treatment every 3 months, like clockwork, to smooth that out. And so that might be a series of 3 to 4 sessions, so over the course of a year. And then in addition to, there may be some other treatment options that I might add on to my clients from the aesthetic side for them as well. Other questions? Okay. I think we're good on those questions. Okay. So one thing I wanted to say, and then Alyssa, did you have any other questions? Good. Okay. I think she's made it there. So one thing I wanted to say, we wanted to thank you guys so much for participating in today's virtual event. This was our first, and we appreciate your patience with everything. We are offering a very special promotion for this month only for all of you guys that have attended. And this promotion is, if you come in for a consultation and treatment for a combination of Botox and filler, you will receive $300 off your total treatment. And that is until the end of the month, so till the 31st. And for those that book in the next 24 hours, we will also do a complimentary lip flip, which is using Botox to give a little bit of a subtle plump and lift to the lips. And so that is a nice combination, and that will be on the house for anyone that books in the next 24 hours. I do have 2 prizes for questions that were sent in advance, and so you know who you are. I won't say your names, but I do have 2 special giveaways for you, and we're going to talk about those. We're going to be giving one of you a Get Ready Skin kit from ZO, and then I have another kit for a product line from Isden Skincare. So for those 2 that sent in questions, we'll be contacting you later today to give you your prizes, and we thank you so much for your participation. Awesome. Thank you guys so much. Have a great day.